and welcome back to our community. Suzie Thomas here with Sarah Hayden, who is Director of Marketing and Communications at the Mental Health and Recovery Services Board of Stark County. And Sarah, we had started talking about the intricacies of drug abuse and alcohol abuse as they relate to mental health and mental illness. And let's go there a little bit more. Tell us a little bit, first of all, about what the board does in this area, what you provide in this area, and then let's get into this. Tell us a little bit about the board.
Thank you, Suzie. Thanks for having me on this morning.
Well, we appreciate
I really
you.
do. Thank you. I wanted to talk a little bit about the opiate epidemic. We had touched on that just briefly, the opiate and heroin epidemic. Mm-hmm. Prescription drug abuse, opiates such as Vicodin or OxyContin, those kind of drugs really have pointed or led to the heroin use. Heroin's cheaper. It's much more available. Unfortunately, we have an epidemic right here in Stark County. One of the things that the board is doing is providing overdose prevention kits to the community. And it's called Project Dawn, and it was begun at the state level. But we're providing funding to the community through Quest, Recovery and Prevention Services, and Crisis Prevention Center. And community members, if they're caring or worried or concerned about a loved one who might be addicted, they can go to Quest or the Crisis Center and get one of these naloxone prevention kits. There's going to be a training where they learn how to use the naloxone drug. It is a nasal application, so it's through the nose. There's a syringe involved, but it's a very simple procedure, and it will save a life. If someone is in an overdose state and you apply the naloxone, it only works with opiates, heroin, and it will bring that person back to consciousness.
Wow. So there is training on how to use these substances correctly. Right. But it's almost like if you see someone going into an epileptic seizure or someone having an adrenaline, that's not the correct word, but if someone is some kind of allergic reaction,
yes,
this kind of a response can save their life. So it's this applied to a drug overdose rather than an allergic reaction, but the same kind of thing. This is what I'm understanding.
It's a quick fix just to give that person enough time to get help. The ambulance or the EMS.
Call 911.
Right, exactly. It is important to give that amount of time just to save their life. That's all they need, because if they go into this state and start overdosing, unless this is applied, they will not survive.
Wow, what a wonderful thing to have on hand if you know that someone has a problem.
Right.
Or
and
suspect.
Exactly, and it's available to all Stark County residents.
Wow. Mm-hmm. Okay, now let's go back 1 second. You said Vicodin is one of the things that leads to this opiate and heroin problem that we've got. Vicodin is prescribed frequently for pain. And you said that there is a program where people can turn in their leftover prescription drugs. You can also just flush them, right? When you're done with something?
Yeah, well, it still stays in our environment that way. The
Okay.
best way is to get rid of them at police department collection boxes or the annual drug take-back day that Stark County has. Those drugs will be incinerated at high temperature. It's the most effective way to get rid of them. They'll stay in our water table. If not, if you dump them in a landfill, they're still available to man or beast.
Oh,
so it's not
good
a
point.
good idea. It's really the best way is these drug collection
turn
boxes.
them in. My other question is, though, so often we're told when we're given a prescription, use this until all of the medication is done, that they've prescribed a certain number of pills, and I just believe whatever I'm told, that I'm supposed to take them until it's finished. Not always?
No, I wouldn't say this does sound leading in the case of I'm not a clinician myself, but this is a discussion with your doctor. If it's pain related, you need to talk with your doctor about how much pain you're actually in, how much pain to be expected, and really what do you need? Do you need all 35 tablets in a full prescription, or can you get by on maybe 5 or 10? So talk with your doctor. This is a really important strategy. Talk with your doctor before you take those, and talk with your pharmacist, because there may be interactions with other drugs that have an effect. So again, get rid of those prescriptions. You don't need them in your home.
Such a good point. Like right now, I would say this morning, take a moment and go through that medicine cabinet and go through that kitchen cabinet or drawer and see what's been left over. Because sometimes it can just linger for months in there before it gets thrown out.
Right. We just do not need to risk the idea that they might get into an illicit supply line.
Good points. All right, what else have you got here for us?
Well, if you're worried about a teenager possibly and drug abuse, there are several factors that can really lead to youth trying and abusing drugs. And some early research that has been discovered on trauma, early childhood trauma. Both mental health and substance use indicates that perhaps somewhere early on there might have been some trauma in that child's life.
Are you talking emotional trauma, physical trauma?
It can take a number of different forms. It can be physical or mental, verbal abuse. It can be witnessing substance abuse themselves. It can be witnessing domestic violence. This is a child, early development of this child, and they're being exposed so young to these traumatic events, and it does have an effect later on in life in the health of the brain. And some folks or some youth might tend to abuse alcohol and drugs, especially if they have a close family member that has had a history of drug or alcohol abuse. It can mean that teen is actually at higher risk. If a teenager is close to family or friends who abuses drugs or alcohol, they're more susceptible to experimenting. And co-occurring illnesses like depression, anxiety, or ADHD puts youth at risk of abusing substances.
What kinds of things, Sarah, should a parent be on the lookout for? Are there some warning signs about children and drug and alcohol abuse?
Sure, there are warning signs. Poor hygiene, lack of caring for their appearance would be something to look for. The smell of smoke, obviously, or unusual smells. Chewing gum or mints to cover up the breath. Reckless driving, car accidents, have they had a few? Change in relationships with the family or with their friends, the abrupt changes, be on the lookout for that. Mood changes, which is typical teenage behavior.
Yeah, a lot of this is typical teenage behavior, although grooming might improve, I think, when they hit adolescence. But the gum and mints, I'm thinking, they're starting to think about what do I smell like to the opposite sex around that time. And so, yeah, it's kind of difficult. It's still tricky, isn't it? You have to know your child.
You do have to know your child. You really do. Deceitful or being secretive is something else to be look out for. Again, it's hard to distinguish that between normal teenage separation.
Angst.
Exactly. But obviously, if they have slurred speech or if it's really rapid fire, if it's very unusual. Truancy, loss of interest in schoolwork, that's just something that you need to be on the lookout for. And here are some physical things you might want to look for. Nosebleeds, sores, maybe some seizures. There are a lot of drugs out there that do unusual things that we don't know much about. And for instance, the K2 spice, I think that's the brand name of it, but it is a marijuana synthetic, and it can have a terrible effect on youth. It actually could help with psychosis.
Ooh.
It could be a major indicator or a major influence on whether or not the teen becomes psychotic. It's just
Oh, my.
scary drugs. That they're synthetics. We don't know what's out there. We don't know what's
Yeah.
in them. They are not FDA approved. It's we just don't know what's in them. But disappearance of prescription over-the-counter pills is something important. So you need to watch as family members. You need to know how many pills you have, what do you have in your cabinet. If you're currently taking them, you need to know what is there. And if you notice something disappearing, that's
That's a
definitely
big sign, big flag.
Definitely. And obviously the appearance of maybe some drug paraphernalia, papers or pipes or medicine bottles or lighters or things like that. So you just need to be on the lookout.
Be aware.
Absolutely. Which makes me think of another program that the board has. It's called Be on the Lookout. And there are resources for parents and caregivers of middle grade and high school students right online at our board website. And that's stark, mhrsb.org.
Let's say that one more time.
Stark, mhrsb.org. And these are BOLO parenting tips. Be on the lookout for underage drinking and drug abuse. There's lots of tips in there to help.
I really think of a parent who's taken in either an adoptive child or is doing some fostering, where it's not possible for that person to know everything about that child's history, or if perhaps they were, involved or saw or observed some kind of a traumatic experience that you're talking about. Do you have some tips for that person? How can we find out more? Are there ways to find out what this child may have experienced, or conversations to open up with that child about what they may have experienced, so you know more about it?
Right. As a professional communicator, Susie, I've been privileged to learn a lot about how these conversations can happen. I'm not a clinician, but I would say as a mother that it's so important that you find a way to have those conversations with your child. Those BOLO parenting tips will provide some openers to help you get started. And you mentioned this as well, you've got to know your child. You just have to know, because then you'll know if there is a difference, or is there something I really should be paying attention to. Is this a little blip, or has this happened a second time and maybe even a third time? So I really need to be paying attention and having those great conversations. Actually, a really positive statistic is that many teenagers will not use drug or alcohol because of parental disapproval, but the parents and the child have to have that conversation.
Oh, that is awesome to know. Sarah Hayden, the Director of Communications and Marketing at the Mental Health and Recovery Services Board of Stark County. Thank you so much for joining us. We're going to give that hotline one more time, 330-452-6000. And thank you for joining us. We hope to see you again tomorrow. This has been Our Community.